Hi everybody, today we're going to take a look at male and female reproductive system. So let's start with the male reproductive system. Right here we have the testes, and on top of the testes we have this coma-shaped structure right here called the epididymis. There is a tube that comes off of the epididymis that is going to carry the sperm out of the body. So this tube, you can track it down. It goes up here, goes around the urinary bladder right here. This tube is called the vas deferens or ductus deferens. Now, if you take the tube with the blood vessels that are next to it, so if you take it as a whole, this structure is called the spermatic cord. So if I'm talking about only the tubing, that's vas deferens or ductus deferens. If I'm talking about the cord plus the blood vessels and the nerves, that's called the spermatic cord. Now the other structures that are visible on this view, you can see the tip of the penis, that's called the glans penis. And then we'll look at some of the internal structures in just a second. But the few other things that is also visible on this view is urinary bladder. So this structure is your urinary bladder. You see this tube coming down right here. This tube is actually coming from your kidney, and this tube is referred to as the ureter. That's basically the one that transfers the urine from the kidney into the bladder for the purpose of storage. You don't see it on this side, but if you look at this tube that is coming in is the ureter for the left kidney. And the one you see right here is the ureter for the right kidney. So left kidney ureter and then the right kidney ureter. Okay, let's take a look at some of the structures inside. So in this view, and I'm gonna show you in the back, so again, orient yourself in just a second. So here's the bladder. Right behind the bladder, you have this gland. This is a paired gland called the seminal vesicle. So this is sitting behind the bladder. And there's a gland that sits right below the bladder called the prostate gland. If you look at it at this view, again, here is the bladder, and then here is the prostate sitting right underneath this. So we know that the tube that is coming from the bladder, which is this tube extending all the way to the tip of the penis, that's called the urethra. This is the tube that is shared for both the male reproductive system and urinary system, basically both for ejaculation and urination. Now, when you look at this tube is broken down to three parts, or has three names. The part that is passing through the prostate gland is called the prostatic urethra. The part that is passing through this diaphragm, called urogenital diaphragm, this area, this is a short part of the urethra right here, that's referred to as the membranous urethra. And the longest part of the urethra, which passes through the length of the penis, is called the penile urethra or spongy urethra. Now, if you take a look at this picture that I showed you earlier, here's the vas deferens or ductus deferens that is merging with your seminal vesicle. And as it merges, and again, I'm gonna flip this model so you guys can see it, it creates this tube right here on the angle coming into the prostate gland, which is the same one you see right here. This is called the ejaculatory duct. So the way you wanna think about it is, the journey of the sperm starts with the testes, goes to the epididymis, comes through the vas deferens. Vas deferens merges with seminal vesicle to form this side tube called the ejaculatory duct. And ejaculatory duct merges into the prostatic urethra, membranosus urethra, penile urethra, and basically removed from the body. Now, when we're looking at some of the erectile tissue found in male, we have two main erectile tissue. The larger one is a paired structure that forms the anterior surface of the penis, and this is called the corpora cavernosa. And you can see it more in the reddish color, those red dots on it. And then surrounding the urethra, so here's my urethra. Those areas that are surrounding the urethra is the second type of erectile tissue that is kind of dotted with the blue dots, and that is referred to as the corpus espangiosa. Hence, the urethra passing through that, which is this urethra right here, can be called a spongy urethra because it's surrounded by the corpus espangiosa. So in the posterior aspect of the reproductive urinary system, this is the extent of the digestive system. So this part is referred to as the rectum, which basically ends in the anus. And one last thing before I forget is the protective skin that is found around the testes is referred to as the scrotum, and you can see it on this picture as well. So here's the testes, and the outer skin around them would be the scrotum. And then you also can see this structure right here. These are actually muscular tissue that is surrounding the testes, and these are called the cremaster muscles. Okay, so we are going to take a look at the female reproductive system here. So right here you have the ovaries. The little extensions coming off of your ovary, that's the fimbri. And the tube that is coming off of the fimbri is called the fallopian tube. So this tube right here is the fallopian tube. So when you take a look at continuation of the fallopian tube, you have the uterus right here. Now, uterus has 3 layers. So if I'm pointing to the whole organ, that is your uterus. But if you're talking about individual layers, the outer layer is referred to as the serosa or perimetria. The thick layer you see right here, that would be your myometrium. And the internal or the most inner layer of the uterus is called the endometrium. This little triangle you see right here is the opening of the uterus called the cervix. And then you have this muscular tube that extends down to the external environment, that is the vagina. Right underneath the uterus, you have the bladder or urinary bladder. And the opening out of the bladder to the outside, that would be the urethra. You have the external genitalia for female. You have the more vascular lips, which are called labia minora. And the outer, more skin-like lips, which are called the labia majora. You have the erectile tissue in female right here, that is referred to as the clitoris. And the fatty layer right in front of the reproductive system, that's called the mons pubis. In the posterior view, what we have right here is the rectum. You also going to have the ureter. So this extension you see coming down, this tube right here going down and continuing going to the bladder, that's the ureter right here. And that's about all I want you guys to know on this model. Just make sure that you guys can identify this as a continuation of this model. So here again is your ovary, your fimbri, your fallopian tubes. What we're going to do now, we're going to switch models. So this is kind of a newer version of the models we have, but we also have access to these models. So we're going to take a look at these as well. So again, same structures we have viewed on the other one. So right here you have your ovary. Little finger-like extensions would be your fimbri. Here's your fallopian tube. This is your uterus, perimetrium, myometrium, endometrium, cervix, vagina, labia minora, labia majora, clitoris, mons pubis, the fat in front, urinary bladder, urethra. In the posterior view, you also have the rectum and then the anus. Looking at the male reproductive system, which is the one we did at the earlier part of the lecture. Again, identifying the scrotum, testes, epididymis, ductus deferens or vas deferens. If it's pointing with the blood vessels, that would be the spermatic cord. Behind the urinary bladder, you have your seminal vesicle. Ductus deferens and seminal vesicle join together to form this part of the tube called the ejaculatory duct. This is the prostatic gland or prostate gland. The tube you see right here is the prostatic urethra, because here's your bladder, here's the urethra. This is the urogenital membrane or diaphragm. So this part is called the membranous urethra. And again, the continuation of this tube going all the way to the external aspect of the body would be the penile or spongy urethra. One thing that the other model lacked is this tiny gland you see right inferior to the prostate gland called the bulbourethral gland. So seminal vesicle, prostate, and bulbourethral gland. Lastly, what you can identify is the two erectile tissue we have. Again, the anterior surface right here would be two or paired erectile tissue called corpus cavernosum. And the one that surrounds the urethra is the corpus espangiosa. And lastly, the tip of the penis is called the glans penis. Okay, that's it.